Day 3 hits. You feel wrecked. Headache, nausea, jittery, almost panicky. You tell yourself it is keto flu, so you push harder and cut carbs even lower. Here's the problem. Sometimes that keto flu label hides something fixable, and sometimes it hides something you should not ignore. The goal is not to suffer for 10 days to earn results. The goal is to know what's actually happening in your body, so you can correct it fast and safely. Moving to slide 2. The first 10 days can feel like a trap because you change too many dials at once. You drop carbs, so insulin drops, and you shed a lot of water and sodium quickly. That can leave you underhydrated, even if you are sipping water all day. At the same time, sleep often gets lighter and more fragmented, especially if you also cut calories, add fasting, or ramp up caffeine. Then training suddenly feels harder, not because you got weaker, but because your blood volume and recovery are down. If you stack all of that together, you can feel miserable and assume keto is the culprit, when it is really the rapid transition. The pattern matters because classic keto flu has a pretty specific signature. Moving to slide 3. Classic keto flu usually shows up between day 2 and day 5. You stand up and feel lightheaded. Your head aches and your energy feels flat, like your battery will not hold a charge. Cravings can feel oddly sharp even if you are eating plenty of calories, because your body is pushing you to restore fluid and minerals, not just carbs. The easiest check is response. If symptoms noticeably improve within an hour or two after salt plus fluids, that is a strong clue you are dealing with the standard adaptation slump, not something mysterious. If salt and fluids do nothing, or you're getting worse, treat that as a signal to slow down and assess, because willpower is not the missing ingredient. Moving to slide 4. When people say push through, they miss the mechanism. When insulin falls, your kidneys excrete more sodium. Less sodium means less water retained, and that reduces blood volume. Lower blood volume forces your heart rate up to maintain circulation, especially when you stand, walk, or train. Your brain is extremely sensitive to that drop, so you get foggy, headachy, and anxious fast. What to do? First, stop guessing and run a simple test. Add sodium and water on purpose. For most people, that means salting meals aggressively and using a salty broth or electrolyte drink once or twice a day during the first week. If you are training, sweating, or using sauna, you need more. Pair it with enough water to satisfy thirst, not gallons on a dare, because over-drinking plain water can dilute electrolytes further. If you have high blood pressure, kidney disease, heart failure, or you take diuretics, talk to your clinician before you push sodium. For everyone else, the fix is often boring and fast, and it sets you up to handle the next confusing zone, potassium. Moving to slide 5. Potassium is where people get scared, because low potassium can feel dramatic. You might notice weakness, heavy legs on stairs, cramps at night, or a fluttery, unsettled heartbeat feeling. Those symptoms can overlap with low sodium, low calories, too much caffeine, and anxiety, so do not assume it is potassium and start megadosing. Start with the safe moves. Get potassium from food first. Meat and fish have some, but your biggest wins are low-carb potassium sources like avocado, leafy greens, mushrooms, and plain Greek yogurt if you tolerate it. Also fix sodium first, because low sodium increases potassium loss in urine for many people, and you cannot stabilize one mineral while ignoring the other. If you choose a supplement, be conservative. Use small doses, spaced with meals, and avoid salt substitute products that can deliver large amounts quickly. Do not supplement potassium if you have kidney disease, take ACE inhibitors, ARBs, potassium-sparing diuretics, or you have a history of abnormal heart rhythms unless your clinician guides it. Done carefully, potassium support makes your body feel steady again, and it often reveals the next driver of how you feel at night. Moving to slide 6. When magnesium runs low, your nights often start to unravel first. You notice little twitches, foot cramps, or that wired, irritable feeling that shows up for no clear reason. Then sleep gets lighter and more broken, which keeps stress hormones higher into the night and the next morning. And that matters because the next day, hunger feels louder, cravings hit harder, and willpower feels thinner. This is how small deficits snowball fast. If this is you, stop guessing. Add a magnesium source consistently for a week, not randomly. Many people do well with magnesium glycinate in the evening, plus magnesium from foods like pumpkin seeds and leafy greens. And if you are cramping, do not forget sodium and potassium, because magnesium rarely acts alone. Fix the basics, and the whole spiral softens. Moving to slide 7. One of the sneakiest reasons you feel awful on keto is that calories drop without you noticing. Appetite can vanish suddenly, so meals become accidentally tiny. Then protein falls quietly because you keep eating smaller portions, or you avoid meat because it feels heavy. Add in fat fear, and your plate turns into lean protein plus vegetables, which is basically an unintended crash diet. The symptoms can look like keto flu, but the driver is low intake. You feel weak, cold, moody, or lightheaded, and you assume carbs are the problem. Instead, track 2 things for 3 days: total calories and protein grams. Hit a protein target first, then add enough fat to stop the deficit from becoming extreme. Keto works better when it is deliberate, not accidental, especially once caffeine is in the mix. Moving to slide 8. Caffeine can turn on you when you are low carb. With less glycogen on board, you have less buffer against a stimulant spike, and jitters can feel like illness. If you are also even mildly dehydrated, caffeine hits harder and anxiety ramps up faster. Then sleep debt piles on, and the next day you reach for more caffeine, which keeps the cycle going. Do not quit cold turkey if you are already struggling. Reduce the dose first. Cut your total caffeine by about 1/3 for a few days. Keep it earlier in the day and pair it with water and sodium. If that calms the shaking, racing heart, or flu feeling, you just found the lever. Get stable first, then decide how much caffeine you actually want. Moving to slide 9. Early keto can make your normal workouts feel brutal. The pump disappears, effort goes up, and you finish a session feeling oddly drained. That is not weakness. It is a temporary mismatch between your current fuel handling and what your routine demands. Recovery can also slow early on, especially if your sleep is already shaky and your electrolytes are low. Sweat loss matters here. If you are training and cutting carbs, you often need more sodium than you think, and sometimes more potassium too. Before you blame the diet, deload. Keep the habit, but reduce volume or intensity for 1 to 2 weeks. Shorten sessions, add rest, and prioritize form. You are aiming to adapt, not to prove something every workout. A smart deload beats quitting, and it also makes digestive changes easier to handle. Moving to slide 10. A lot of what people call keto flu is actually gut change. Constipation is common when you drop fiber fast, especially if your vegetables shrink and you rely on cheese and meat. Fix it by adding fiber on purpose, not by guessing. Keep carbs low, but increase low net carb fiber sources like chia, flax, psyllium, avocado, and non-starchy vegetables. Add water and sodium because fiber without fluid can backfire. On the other side, diarrhea often comes from sugar alcohols and keto treats. Maltitol and large amounts of erythritol can pull water into the gut and cause cramping. If you are having loose stools, remove sugar alcohols for a week and see what happens. Fat is the other common trigger. If you rant fat too fast, your digestion may not keep up at first, and greasy, urgent stools can show up. Increase fat gradually, spread it across meals, and choose easier fats like olive oil, eggs, and yogurt before you go heavy on liquid fats or massive cream loads. Your food choices are steering these symptoms, which is good news. Adjust the inputs, and your gut usually settles unless something else is going on. Moving to slide 11. Sometimes what you are feeling is not keto flu at all. If you have a fever, a productive cough, persistent vomiting, clear dehydration, severe abdominal pain, chest pain, fainting, or confusion, treat that as a medical situation, not a diet issue. Stop trying to push through it and get medical help quickly. Keto is a tool, not a test of toughness, and some symptoms are warning lights that matter more than macros. Moving to slide 12. If you have diabetes or you use glucose-lowering meds, keto changes the math fast. When carbs drop, your insulin needs can drop too. And if you keep the same dose, you can crash into hypoglycemia. Sulfonylureas are a common trigger for lows for the same reason. On the other side, SGLT2 inhibitors can raise the risk of ketoacidosis even when blood glucose is not very high, especially with illness, dehydration, or aggressive calorie restriction. So be concrete. Check your glucose more often during the first couple weeks. And if you feel unusually sick, weak, nauseated, or short of breath, check ketones and call your clinician. Keto can be safe, but medication changes should be guided, not guessed. Moving to slide 13. Here is a quick self-check you can run in under a minute. If you stand up and feel lightheaded, that often points to low sodium and low fluid, not a lack of willpower. If you get cramps or eyelid twitching, think magnesium first, especially if you already cut out processed foods. If your legs feel heavy, weak, or you get a pounding heartbeat with normal effort, potassium may be lagging, particularly if you are sweating or eating very little. If the main issue is gut symptoms, look at food triggers, like a sudden jump in fat, sugar alcohols, or large amounts of dairy. If symptoms escalate day after day instead of settling, assume something else is going on, and respond like it matters. Moving to slide 14. For days 1 through 10, set yourself up to win. Plan electrolytes daily, not just when you feel bad. Eat enough protein to protect muscle and keep hunger predictable. Keep carbs consistently low so you are not flipping in and out of adaptation. Deload training for a week so fatigue does not get misread as failure. Track symptoms, then adjust calmly instead of making 5 changes at once. If this helped, subscribe for more evidence-based guides, and comment with what symptom hits you first when you start low carb. This content is educational and not medical advice. Consult a qualified clinician for diagnosis or treatment. Energy is a metabolic outcome, not luck.